Maybe while we're waiting, I'd invite those who are joining to introduce themselves in the chat. We have a lot of faces that I'm not familiar with or names that I'm not familiar with, and it'd be lovely to know who you are. So please feel free to drop your name and where you're joining from in the chat today. Thanks. Good morning to everyone who is joining. We're so glad you're here. We're just waiting for a few more moments for a few more joiners. And we'd love to invite you to introduce yourself in the chat so we get to know you a little bit more. Thank you.
I think, Jessica, we think we can start. I'd given people 4 minutes to join in. We can start now.
Sounds good.
They'll be joining in. At least we have got a number of 42 people. Others may join in as we continue.
Sounds good. Wonderful.
Thanks a lot, Jess. Good morning, everybody who's joining us from here in Uganda, across the globe. And I just want to welcome you to our 38th webinar. That's the Water Resources Institute webinar. That is the Water Resources Institute is under the Ministry of Water and Environment. And those of you know it, those of you don't know it, we are and even those who are related to the sector being water and environment sector, those who don't know like exactly what I'm talking about. And this sector, as you very well know, is a cross-cutting sector. Every industry, every sector always taps in water, taps in the environment. As actually, when you look at it, most of the raw materials they use in industries are related to the water and environment. So the Water Resources Institute is a capacity building institution under the Ministry of Water and Environment. And we do our activities with partners. We do activities with state
Like maybe
members.
we've
I'm
lost.
very sorry.
Yeah.
I think my internet went off.
All good. You're welcome back.
Yes, so come back. I was talking about what we do as a Water Resources Institute, and I was talked about we are a training institute of the Ministry of Water and Environment, and I said we train members across the globe. We train members in transboundary, regional, and also at the national level, and within the local government, within the Uganda establishment. I don't want to go further to talk about the institute. You can have our institute through the website. You can understand the institute if you contact one of us, either Francis or me. So this 38th webinar, we are hosting it in partnership with people. I think all of you have seen the flyer that is talking about today's webinar, and we are looking at lessons from the WABES Applied Research Project in Uganda. We have several presenters, as Jess will be introducing them. And we hope that through this interaction, understanding, and the dissemination of information, to be very profitable to us who live in Uganda and beyond Uganda, and we'll be able to look at the impact of the water environment, wastewater management, water supply, wash, and everything that is related to service delivery, and almost inclined to the water and environment sector. I think with those few words, I just want to send a message. I want to release my state to Jesse to take over. Jesse, I think you can take over. Members, you're welcome. You can join in. As Jesse had requested, please send a chat to introduce yourselves. We want to understand those who have attended. We want to know those who have attended, and we keep them in our database in future reference and future use and future interaction and networking. Thank you, members. Back to you, Jesse. Thank you.
Wonderful. Thank you so very much, Gwendolyn. It's wonderful to be a part of today's session. And as Gwendolyn mentioned, we're going to be sharing some lessons from the WABES Applied Research Program in Uganda. And I will be sharing a little bit about what WABES is, but then handing over to my wonderful colleagues who will be speaking more to some of the lessons and the insights from this research. So today's objectives, we're hoping to learn a little bit about the program and explore some highlights from 5 different aspects of the project in Uganda. And ideally, we would love to reflect on what policymakers, what practitioners can adapt, adopt, and abandon. I don't know if you've heard of these 3 things. So what can you take away? What can you adapt for your particular context or work? What can you adopt for your particular context or work? Or what might you want to stop in your particular context or work based on some of the insights and the learnings from today? Just a fun framework to help you think through the insights. We've had our opening remarks, and now we're going to go into a brief framing presentation. And I'd like to invite our speakers to come off on camera. And very quickly, we'll do a really quick round of introductions to our speakers. So we have today, I don't see Charles on the line yet, but maybe he'll be able to help us a little bit later down the road. Jump in as you want. Laura, you are unmuted. Go for it.
Good morning, everyone, and I'm very pleased to be here, and thank you so much for inviting me to join this webinar. My name is Laura Velasquez. I'm a scientific project manager at Eawag. I mainly focus on solid waste management projects, and I'm very pleased to tell you more about our work later on.
Wonderful. Abu.
Thank you very much. Good morning, everyone. I'm Abubakar Bate. I'm from Makerere University. I'm a research assistant, and I'm very pleased to be here and looking forward to share more. Thank you.
Thanks, Abu. I'll hand it over to Matteo.
Hi, everyone. Sadly, I cannot activate my camera for some reason. I think it's disabled by the host. There you go. Thank you. Hello, everyone. I'm a master's student at Eawag, working on wastewater monitoring to see if there's any virus in the water and to understand the patterns. I'm really excited to present you my work, and I'm excited to connect and discuss afterwards. So thank you.
Wonderful. Marissa, and then we'll end with Ronald.
Hi, everyone. I'm also very glad to be here. So I'm Marissa Boller. I'm also scientific project manager at Sandec. I'm working mostly on projects on water supply and water treatment. And I'll be glad to tell you a bit more about our work specific to the water sector that we have been doing in the small towns.
Last but very not least.
Hi, everyone. Ronald Sakaya. Makerere University, I actually worked on the WABES project in the small towns of Kakooge and Wobulenzi on the integration of water supply, sanitation, and solid waste. Very glad to be part of the team and share our insights.
Wonderful. Thank you so very much. And we'll have Christoph Luthi also from Eawag joining at the end of today's session. Maybe just a very brief, so presenters, you're welcome to turn your videos off. And we'll have you join back on when it's your time. So just a very brief introduction to Eawag. Eawag is the Swiss Federal Institute of Aquatic Science and Water, so water, science and technology. And we deal primarily with fresh water, so not salt water, but fresh water. And we look across aspects of health, climate, biodiversity, and water cycles, including wastewater and pollutants. And you'll see some of the different aspects of these interests coming up in today's presentations. Sandec is a particular department within Eawag, so we're moving down. And within Sandec, we are the Department of Sanitation, Water, and Solid Waste for Development, or Sandec. And we want to create a world where everyone has equitable access to safe, resilient, and sustainable sanitation, water, and solid waste services, facilitated through innovation, research, and global collaboration that drives progress, protecting health, human health, and environmental health. It just gives a little bit of a background on us as a department. We work globally, but have a lot of programs in Uganda and long-term partnerships in Uganda. We support accessible research, and ideally capacity strengthening is a big core part of what we do as well. I'm going through these a bit quickly, but we will make sure that you have access to the slides afterwards. We have 7 different research groups alongside our WASH Learning Lab. The WASH Learning Lab looks at training and capacity strengthening, and our different research groups focus on water, sanitation, solid waste, and climate and infrastructure. As we go through today's presentation, we invite you to put your questions in the chat. We'll do our best to respond to all of our questions, but we might not have time for everyone, and we'll get back to you if we miss your question. So a little bit about the WABES program. WABES stands for Water, Behavior Change, and Environmental Sanitation, and we're looking at creating sustainable solutions, bridging research and practice. I'll hold this slide up for just a second. In your mind, I'd love for you to take a look and think about what you think these different boxes might mean. I'll just give everyone a second. All right, so this work, really, we focus on water, which is that first bucket, sanitation, our second bucket, waste, solid waste, our third bucket. The purple one is a little bit more confusing. That's integrate, and that is where we work across these 3 different buckets of water, sanitation, and solid waste together. And then we also have a focus on learning and sharing information. And so these are kind of the main kind of aspects or buckets of work within the WABES program. Again, outcome 1 is focused on water. Outcome 2 is focused on waste and wastewater. Our third is our integrated bucket, where we look to bridge water, wastewater, and solid waste, and then our capacity development. So when bridging those, then you can see we kind of the outcomes. Outcome 2 spans 2 different thematic topic areas. This is going to be a lot of text on a slide, and again, we'll share these around, but it's more just to show that we're doing a lot of different types of research. Please do not feel like you have to read every word on the slide. It's just to show that we've been doing a lot over the last years. We are in our 4th year, and lots of different activities are happening across a wide range of different topics. And we're going to be presenting just a few highlights from these main list of research activities today. We are operating again globally, but Uganda is a center point for our work, and we have a long-term collaboration with Makerere University, and are working in 2 small towns within the WABES program, as well as Kampala, so across 3 different contexts. And again, our focus country is Uganda with Makerere, and we also have an MOU with the Water Research Institute, which is one of the reasons we are sharing some of our insights today in this webinar. And our focus in our work with Water Research Institute is knowledge exchange, research partnerships, and joint dialogues, of which today is one of those. Wonderful. There are many, many different outputs that we have created in WABES. If you are interested, I will type the link into the chat and feel free to go ahead and look at those. But again, there's lots and lots of information, and this was a wide-ranging research project. We're going to touch on a few of these topics, but we won't be able to get to everything today. So we do encourage you to explore in more detail on your own. That was quite rapid, I understand, but thank you for your patience as I shared a little bit about the WABES program and gave a bit of background. We're now going to invite Laura to come and talk a little bit about solid waste. So over to you.
Thank you so much, Jess. All right. Like Jess introduced, solid waste is one of the focus areas that we looked at in the WABES project. And here you can see, one of the many, many dump sites that you would find globally, also really visually seeing how solid waste is still a big issue in many places. Next slide, please. So when it comes to solid waste management, unfortunately, still in many countries, the systems are often poorly run. And there's many reasons for this, but mainly it's due to rapid urbanization and also lack of resources. And the main consequences that we really see across the globe to be the main barriers for a proper or adequate solid waste management service are firstly collection, so inadequate coverage of collection service, recycling. So often it's very unregulated. You have a formal and informal sector, clashing and also not working together. And lastly, disposal. So really often improper disposal in open dumps is still one of the main activities, as well as open waste burning. And this is still also the case in Uganda. So here to the right, you can see one of our assessments that we did in the two small towns, where we really looked at how the solid waste management system works. And just as I described, there is formal collection in the two small towns. However, there is also informal collection that mainly looks at recycling and recyclables. And then when it comes to disposal, we either have dump sites, but also still there is a lot of open burning and dumping in these two small towns. Next slide, please. So some activities that we did, after this initial assessment, what was first, we did several workshops, and you will hear about some of them from my other colleagues. So I won't go too much into detail, but here you can see a picture from one of the capacity strengthening workshops that we did, where we worked together with the town council members, and we did a very practical training on waste segregation and dump site improvement. And another very crucial activity was to conduct a waste audit. And we needed to do this to take a step back and really collect, basic data on how does the waste situation even look like in Kakooge in this case. And we conducted a waste audit where we collected waste from 100 households over a span of 8 days. And we came up with the results, that in Kakooge, around 0.9 or 1.2 kilograms per day per person are generated. This is different depending on if you're in the urban or the rural context. And a very crucial result, insight that we got is that organic waste is the largest fraction out of it all, ranging between 76 and 79% of overall waste generation in this small town. Next slide, please. So with this knowledge and, over the years working together closely with the town council, we identified some really challenges. On one side, we identified that the dump site in this small town is located in a sink, which is then prone to flooding, especially during the rainy season. This also then causes very poor dump site access, which leads to the collection truck actually getting stuck or breaking down at the dump site. And the dump site, and you will see a picture later, it's very uncontrolled and unprotected. So this is very, inviting nearly non-households or households to just illegally dump their waste in this site. On the other hand, now talking about organic waste, we also identified that there is limited and unreliable waste collection service, and especially that 78% of household waste is organic. So this is a very heavy fraction. And there is in the small town an absence of adequate treatment options, specifically for organic waste. Next slide. So then what we did or came up with were mainly two solutions. One of them was to implement a low-cost upgrade of the disposal site. Firstly, we did a very thorough assessment of the disposal site and how to improve it. And actually ongoing right now, some of the activities have been happening. For example, site clearance and access roads. So we really cleared some of the waste that was already accumulating and improved the access to the dump site. We are working right now on fencing and gating the dump site. This is to avoid the illegal dumping that I mentioned. There will be an office installed, for on-site surveillance, PPE and tools, so protection and tools for the solid waste collectors, and also there will be some work on the drains. Next slide, please. Now, when it comes to organic waste, this was quite a tricky topic to look at because focusing on a centralized solution was not feasible at the moment with the resources that this town council has. Therefore, we opted to a more decentralized option and involving households directly. So the idea here is to install these composting bins that you see here to the right in 100 households. This is a very easy to use technology where households can insert or put the organic waste in these bins, and with very little work they can actually produce compost out of it. Right now, we've been conducting some training and workshops with the households that are receiving these bins, and in the coming months we will do some follow-up and monitoring on how this pilot is working. Next slide. So, I'm already finishing the solid waste part. So I think some of the key lessons was really that organic waste is the largest waste fraction and really needs some focus. And this is not an unusual case. This is quite common across the globe, but especially in a low and middle income context. Collection service is crucial to really move the waste from the households to an organized disposal site. And this pilot, especially with the households, with the composting bin, shows that households can be involved in the service, especially in a short term to really also involve them in managing the waste. Looking ahead in solid waste in the specific two small towns, so the dump site improvements are only a temporary solution. This is very important to know. Long-term goal is really to have a new site for a proper controlled landfill. And with the composting bins, looking ahead, the idea is to expand to more motivated households to receive also a composting bin. And that's already it from my side. I'm very excited to hear some of your questions. Thank you very much.
Wonderful. Thank you so much, Laura. We will take questions kind of in clusters. Thank you so much for putting them in, but what we're going to do is 3 presentations together, and then we'll do a Q&A, and then we'll do 3 more presentations and then another Q&A, and then we'll have time for open discussion. So this will be the last presentation of our cluster of 3, and then you're welcome to ask questions about WABES, about the solid waste, and about the learning. But with that, I will hand it over to Abubakar, to Abu, to share a little bit about learning. So over to you, Abu.
Thank you very much, Jess. Good morning, everyone. I'm Abubakar Bate from Makerere University. I will take it on from here, and I will basically talk about the learnings or the capacity development side of the WABES Integrate project. Next slide. Having a look at the introduction, we are working from 2 towns, that is Kakooge and Wobulenzi. And from the integrated baseline assessment that we had in 2023, we found out that fragmented coordination, limited financing, weak ownership, and lack of specialized knowledge were some of the hindering factors for hindering the service provisions when it came to WASH. So from these 2 towns, Makerere University and Eawag partnered with these 2 towns to say that we can close these gaps, and through not only co-creation, but also through not only a training alone, but also through the co-creation, as we are going to see in the next slides. Next slide. Great. So this started with a co-creation workshop. This co-creation workshop was held during the Uganda Water Week, and it was a half-day workshop in which we assessed the needs of these towns, jointly assessed the needs of these towns, and prioritized 2 top interventions. And these two top interventions were the GIS training and the WASH refresher training. The GIS training was a 4 months training, and this involved field data collection, for example, moving to these towns and learning how to collect data for a given parameter, for example, water infrastructure, then importing this data into the GIS and producing maps for this specific infrastructure. This training involved video-based learning, which was online, and also physical classes, as you can see in the picture labeled 2. That's one of the examples when we are having our class or lesson. Then from that, we went ahead to have a practical WASH refresher training, and also this came out from the co-creation workshop as a priority. This was a 3-day workshop, and in this 3-day workshop, it was organized in a way that it was learn, facilitate, and design approach. So this approach, we had the participants from the 2 towns come at one place. Then we divided the 2 groups into, we merged the groups to form one group and then divided them into 2 groups. And each group had participants from each town. So during these 2 groups, each group took one learning. So there was a group that went for water quality, simplified water quality testing, and another group which went for waste segregation and dump site improvement, as Raul already mentioned. So these 2 groups, on the first day, they had to learn about this. So they learned about how to collect water samples and going ahead to do the water quality testing. And also the following day, they had to learn about how to interpret the results. And then the next day, it was the day for them to facilitate. So each group had to facilitate what they had learned in the first day to another group. And then we were around to guide them and also support them whenever there was need. And on the 3rd day, these groups came back to learn how to design similar exercises that they could take home and facilitate to other colleagues from their own towns. So this was how it was organized. And one key aspect during this facilitation was the learning buddy system. So we paired each individual with another person from another town, and we could give them some time to reflect on how the exercise was going on. So this learning buddy helped us a lot in creating that time for them to reflect and also ask, but also creating that bond between the members from different towns. Then from that, we had the last follow-up workshop to see how, from these 2 activities, how were the towns progressing. We can go to the next slide. What we found during this follow-up workshop, that this is what was already done. 9 town council members had trained during the GIS training using the QGIS. Then over 16 members also got the training, the WASH refresher training, and these included 4 VHT members. Our findings was from the GIS training, there was some improvement in infrastructure planning. Participants from Kakooge Town Council had started mapping their own roads, mapping and naming their own roads. Then from Wobulenzi Town Council, they had done a benchmarking visit in which they went to Gulu City to see their land field so that they can learn a few things from how to improve their dump site in Wobulenzi. Then still in Wobulenzi, they made plans to relocate their dump site. And this was also a result from that training that we had. And lastly, they had done more water quality testings on several water sources in their towns. Next slide. Yes, the key lessons from the capacity development side. One is co-creation builds real ownership. And in this, it eliminates the need for a separate handover phase. Since the town council members were involved from day one, so there is no need to have a handover phase. The second one is training alone is not enough. So what do we call for? We call for a dedicated financing to ensure that these technical gains can be sustained. If there is no financing, from what we found out, it's very hard to sustain these technical skills. Then another one is peer-to-peer networking. Merged is a very powerful tool, and this keeps the learning alive even after the project ended. Looking forward, embedding co-creation and peer learning into a national WASH and citywide inclusive sanitation strategies. This is something we would recommend. Two, formalizing learning by the system into lasting community of practice. We would also recommend integrating these learning by the systems so that it can even be supported by digital platforms. And lastly, we advocate for local government budgets that aligns for WASH operation and capacity development. Next slide. Yes, in summary, there are a few key enablers. For example, having the practical-based training and also the learning by the approach. We also identified a few barriers like the limited finances and technical expertise. Key learning from our co-creation was that co-creation eliminates the need for handing over phase. And we also found that this is a replicable and adoptable model that can be taken in other contexts. You can scan the QR code to obtain more information from the Sandec news on this co-creation workshop. Thank you very much.
Thank you to Abu and that was fantastic. And you can see the synergies between what I was presenting, what Laura was presenting, and Abu was presenting as well. So we hope those synergies continue to percolate in your own minds. I'm going to invite us now to go to a short Q&A. And so I will invite Laura and Abu to come on. They're wonderful, great. And I'll just share a few questions. We have so much more that we could present, everyone. So please bear with us. I mean, trying to synthesize 4 fantastic years of work into a 10-minute presentation or less is tricky for a lot of our teams. So thank you for your questions. We have one question here from Philip, looking at, and he asks, why are the organic waste, or wondering why the organic waste proportion is smaller in rural compared to urban? What types of waste were generated? I'm assuming that's for you, Laura.
Yes.
Go for it. Yeah.
Thanks, Philip. That's a really great question. So what happened during this waste audit was that we found out, or we realized that the rural areas of the small town have no access to waste collection at all. So what happened is that during this waste audit, where we collected waste of these households for 8 straight days, we received a lot of accumulated or old waste as well, that these households had stored for a while. So this is maybe a first explanation of why the fraction of organic waste is lower than expected, because in the rural areas, other fractions were larger, one of them being textiles, for example. And another reason is, or another explanation as well, is that the fraction might be smaller in the rural areas. However, the actual amount is larger. So I don't know if you saw, but in the urban areas, the generation is around 0.9 kilograms per capita per day, while in the rural area it's 1.15. So still the overall mass of organic waste that is generated in rural areas is still larger, which is quite common. But it's a great question, because when we were looking at the results, we were also wondering about this. Another also explanation is that rural households have a lot of space to treat their organic waste. So a very common habit that they have, and this is also something that we collected data on, is that they dump it or compost it, or just let it degrade somewhere on their premises, which then of course led during the waste audit that some of the households just didn't give us all of their organic waste that they generate, because with the households we had the agreement that We really just wanted to collect the waste that they do not use for own purposes. So anything, for example, that they would feed to their animals, we didn't collect. So that also decreased a bit the percentage. Yeah, but great question.
Wonderful. We've got a couple more on solid waste.
Yeah, it's
Sorry, Laura.
no, it's
Yeah.
good.
Institutionalizing solid waste management for sustainability.
Yeah, that's a tricky one for sure. I think one key aspect is really working with the town council and, you know, making sure that they understand the whole solid waste system and what is necessary. In Wobulenzi, you had the case where waste collection was given to a private company, for example. That is one option to institutionalize solid waste. However, this works, for example, if the financial resources are there, right? And, if the finance is given. This then also has to do with fees, solid waste collection fees, which is a big topic. So that is also something to be targeted. However, this needs close monitoring and close work with the households, with their incomes, because in a Kakooge, for example, at the moment right now, that wouldn't be a solution since the collection service is very irregular and unreliable. So asking for a collection fee from the households would create, this problem where they would be paying for a service that they are not receiving um, in a certain quality that they want. However, I think this is some of the first steps. So focusing on collection, like I said, and also implementing a fee to the households. Yeah.
Wonderful. There's still a couple more questions for
Yes,
you.
go ahead. I'm ready.
Wonderful. So I'll put them into two and then you can maybe answer them
Yeah.
together. The first one is how are the households selected for the composting
Yeah.
bin activity? And then the
Mhm.
second one is around integration. So maybe you can kick that off and we can continue to spiral. So in a good way. So solid waste, fecal sludge management, methane reduction, co-composting, resource recovery, carbon credits, climate financing. Lots of different pieces there. Maybe you want to pick up on something related to the co-composting.
Yes. So I'll touch upon the first one. So how were the households selected? We selected, first of all, we decided to only work in the urban area. The reason being is that these are the main areas that um, would receive collection, but don't right now, and also the ones that don't have a very good alternative to reuse their organic waste. So for example, rural houses, like I mentioned, they, at least have the option to feed this organic waste to animals, or they have maybe, a large piece of land, or they just have more space to take care of the organic waste, whereas in urban areas, this is not the case. So that was the first decision we made. Secondly, we worked together with village health teams. So part of these households are actually members of the village health teams, then being crucial to understand this technology, to know how this composting works, and then also to train and teach it to other households. And third, another selection criteria was really for them to have a buy-in. So for them to really, sign an agreement that they would actively use the bin and also allow us to, give them trainings and be monitored or come and check on the bin every now and then. Yes. So this was a collaboration with town council, village health teams, and us to select these households. And yeah, to the other question, so it was, if what the links are. So one link that we didn't mention, but it's a great, or maybe it will be mentioned, I don't know, is, for example, the link between solid waste management and fecal sludge treatment. In Kakooge, it's this special case where there is a fecal sludge treatment plant. However, it is being underused. So a very motivated partner of ours decided to initiate a co-composting pilot. This is a quite common synergy that solid waste has with fecal sludge, where you can actually collect organic waste. In this case, it wouldn't be from households. It would be more from markets or non-household generators like restaurants or factories, combining it with fecal sludge and then, using a co-composting technology to co-treat, both waste streams, for example. So that's a big one. That is the case right now.
Amazing, thank you. And I see a great question around kind of long-term sustainability. Maybe I'll take a crack at this one as well. Even more than
Go
just
ahead, yeah.
waste. I mean, one of the challenges about being an applied research team is we work alongside many of our partners for research. We generate evidence. That's kind of our whole. That's what we do as a research team. And so, in generating evidence, it means we're not always able to be around for the long term, and that's tricky. That is a tricky part of what being an applied research team. And so ideally, the interventions and the activities that we're doing as part of our research will continue, but this remains a challenge. I would love Abu to actually also take on a little bit of the sustainability question. How do you think research activities can be, interventions associated with research activities can be sustained? Go ahead, Abu.
Thank you very much. I would say, like I mentioned, having co-creation as embedded into these activities from the start kind of provides the town councils with the ability to be engaged from the planning, implementation. So by the time because as you've already mentioned, we are doing research and it's a short time. By the time we leave, they are partly empowered or some are fully empowered to sustain some of these activities, going ahead with the planning and also the implementation. This is something I would say. Yeah.
Wonderful. Thank you so much.
Welcome.
That's a great answer. Any other lingering questions? Oh, there's one around life cycle assessment. Oh, that's a good question. Either Laura or Abu, have we ever, or Laura, sorry, Laura, have we used life cycle assessment activities within solid waste at Sandec?
No, we haven't yet. However, we have discussed this before. We have other projects outside of WABES where we look at it more closely. Also, for example, looking at greenhouse gas emissions by uncontrolled dump sites. So in this specific project, we didn't. However, it is a great tool and can be of great use, in general. Yeah.
Fantastic. Wonderful. We have a couple of more minutes. We also had one question in the Q&A, non-biodegradable waste. I think we touched on that. How do we handle non-biodegradable waste at the moment? Yeah, go for it.
Yes, so important one, even though it is a small fraction, so only like 20 to 22%. Right now, households that don't receive collection mainly burn this waste, and those that do receive collection, the waste ends up in this dump site. So the treatment or the disposal methods of the non-biodegradable waste is not ideal at the moment. The long-term goal would be to really have a sanitary landfill where this non-biodegradable waste would really be in a controlled dump site. Leachate would be captured and wouldn't, go into the soil. But that's a long-term goal of the town council. But great question, because even though with organic waste we're looking at 80% of the waste, the other 20% is still quite key. And unfortunately, most of it is still being openly burned.
Yeah. Sorry, Laura, we just have a lot of questions for you.
No,
we
that's
don't talk
good.
about solid waste so much. And so when we do, we have lots of questions about it. So
That's great.
there are three. I think you can read them in the chat. They're attitudes around waste sorting and recycling. Yeah.
So wait, which one? I don't see it.
It's from what attitudes do households have towards waste sorting and recycling?
Oh,
3 comments up.
great question. Great question. So, as I also mentioned, there is an informal sector present in Kakooge. And they are quite important in really making sure to at least collect some of the recyclables and feeding it into a more sustainable, system where then it gets brought to Kampala and then recycled and so on. Now, the households, and this comes from interviews that we had with these informal collectors, the households have maybe a very divided, let's say, attitude towards this. One thing on recycling is that they benefit and they like to, for them, they benefit if their recyclables are collected. However, some households actually use these recyclables to burn them and, to either create fire or cook. So it's not necessarily that all of them like to give the recyclables. And when it comes to waste segregation, it's the same thing with organic waste. Actually, when it comes to organic waste, a lot of households do segregate and sort, but they're for their own use. So mostly it is for animal feeding. So their attitude is that, to summarize it, is that they only do it when there is really a direct benefit from doing it. However, it doesn't necessarily come from any, environmental incentive, or health incentive even. It's really directly linked to a purpose of this segregation behavior.
Yeah, wonderful. We have time for 2 more questions. They're all for Laura, which is great.
Yes, go ahead.
So, Abu, your presentation was so clear that no one had any questions at all. It's great. So regulations, most of the existing solid waste regulations that fail to keep up the pace with waste generation, where should we deploy resources immediately to bridge the gap?
I wish I had more time to answer this question.
Yeah.
This is absolutely true. So the regulations there is a gap or really contradict each other. However, the resources at the moment, really, I would suggest to invest them really locally. So working together with these town councils, and also investing in, first of all, service provision. And then once a town council is able to provide and really regular service, then they have the basis to then really start, controlling or even, fining these behaviors such as waste burning or dumping, which are not very well regulated. So I think that would be my first suggestion. Yes, waste collection.
Wonderful. Waste collection.
Service provision is really key and should be prioritized.
Amazing.
Yeah.
Wonderful. Thank you. Well, that comes, we probably could continue asking questions about this for a long time.
I can try to answer some of them in the chat as well.
That's what I was going to recommend. Absolutely. So if you have questions for myself, just broadly on WABES, for Lara or for Abu, please feel free to drop them in the chat. And we're going to move to our next set of 3 presentations. So once again, those presentations will be on wastewater monitoring, water chlorination, and then also planning, bringing all these different pieces together in planning. So I'm going to invite Matteo to join, and he'll be sharing his own screen. And I will highlight and spotlight you. Matteo, go for it.
Can you guys hear me well? Perfect. And can you see my screen? Yes.
We can, yes.
Excellent. So hi, everyone, again. I'm Matteo Gadenzi. For the newcomers, I'm a master's student at Sandec, and I'm doing my master's thesis on water monitoring, and in particular, fecal contamination of the drainage system in Kampala. So what I want to focus on today is what influences the fecal contamination of the open drainage. This is a very broad question, very transversal as well, and I'll try to take you through the different aspects of my answers because I'm currently working on thesis, so sadly I don't have all the answers yet. But first, maybe we should understand why it does matter to look into the influences of fecal loads in the drainage. And first, I would go with improving sanitation. So we know that finding pathogens in the drainage may indicate that there are leakages or dumpings, illegal dumpings, as well as we could try to understand in what proportions as well. It can also highlight the occurrence of insufficient sanitation, bad planning, maybe open defecation as well, and maybe poorly managed neighborhoods. And it can also tell a story about inequality and how resources are distributed. So this is the first reason why. Then what we can also take a look at is help to prevent fecal contamination. So understanding what the influences are will help us protect potable water that could be contaminated downstream, for instance, or people could be exposed to drainage water and contract infections. And yeah, it could also, I mean, the question could also be what is the path for pathogens? So where do they go through? Is it gray water discharge across the streets during flooding events? Can these pathogens be found elsewhere in the environment, and could they be continuously brought by runoff to the drainage? These are all open questions, and understanding that will help us a lot. And of course, finally, all of that combined can ensure safe urban planning in the future. We know that particularly in Kampala, we have a lot of rapid urbanization that's happening now. And understanding these mechanisms is going to help protect the largest amount of people. A little bit of background first. So the first step that I took here was to sample the drainage system in multiple locations and test for pepper mild model virus. So this sounds a bit complicated, but let me break it down to you. So first, 10 microcatchments were selected in Kampala. We delineated them based on these sampling locations, the yellow stars that you can see on the map. And these catchments account for socioeconomic variability, and it's actually work that was done by Abu, Charles, Dick, who are our partners directly on site in Kampala. So thank you a lot for that work. And in these sites, we sampled series of samples, actually, water samples during 2 different periods. And in these samples, we tested for PMMOV. So what is PMMOV? It's a virus that is found in pepper and paprika and a lot of processed foods as well. It is harmless to humans, and it survives the human digestive system. So in addition to that, it's also highly human specific. So it means that it can be found in humans, but not in other animals, for instance. And this makes a great candidate for a reliable proxy for human fecal loads or human feces in the drainage. And that's the reason why we chose this pepper mild model virus as a proxy. You can see on the right the image. So this is a contaminated pepper, but most of them hold the virus anyways. And here you have an advanced stage of contamination. Then once we have these samples, what we want to understand is basically the mapping of socio-environmental or socio-economic criteria in the different catchments that we have. So for instance, if we take a closer look on a few parameters or criteria that I've chosen, we have, for instance, on the left, the containment types and their distribution in one of the catchments. You can see fully lined tanks or pits, septic tanks or unlined pits and their distribution. And on the right, you see the flooding prone areas. So basically, you also see that unlined pits find themselves in flooding prone areas, which could actually be a problem because you can then have runoff that takes away some pathogens. Then we have the distribution of incomes, for instance, high, low, middle incomes as well, and the predominant building use. So basically what kind of activities we mostly see in these different areas. And these are all parameters that will then be correlated to the samples, the pathogen samples, to see if there's any link between these quantities. Then what we also want to take a look into is environmental parameters. So first, we want to take a look at meteorological data, rainfall, antecedent rainfall. So basically, it's cumulated rainfall through multiple days, and temperatures, of course. And with this, we also want to take a look at how terrain mediates this weather data through hydrological responses. So basically, each catchment will have a different signature, different response to flooding events or to rainfall events. And what we want to understand is how this terrain reacts and changes the behavior and the transport of these pathogens. So with time of concentration, which means basically that water will take a longer or shorter time to reach the exit, and hydraulic capacity, which means that the catchment can hold water before it starts running off. And this may be different in each single catchment. Then once we have everything, then we want to analyze the data. We want to be able to correlate basically PMMOV and the socio-environmental parameters, for instance, to understand which could be the drivers. We also want to correlate the hydrological characteristics of the different catchments and the loads, so the fecal loads, to understand if that also plays a role. And once we have these correlations, we want to be able to establish a predictive model to make sure that we understand exactly how it works. But the question here is, do we have sufficient data? And what criteria should we base the model on? Because that's a big question nowadays. A lot of people are trying to build models, AI and so on. But here the real question is can it be reliable with the data that we have? And the overall objectives are the following. So the first one would be to understand the share of population whose feces end up in the drainage in each catchment. To understand the context leading to different levels of contamination, of course, and to provide actionable insights to lessen contamination and improve sanitation management. If you want to learn more, my supervisor, Seju Kang, has been working a lot on this together with people in Kampala directly, and there's a little video that you can watch for yourself that talks about wastewater epidemiology, monitoring, and yeah, feel free to take a look. It's very interesting. And thank you very much for your time.
Thank you so much, Mateo. It's wonderful. And again, if you have questions, feel free to drop them in the chat, and we will continue to answer them in our block of 3 after 2 more presentations. I'm just going to type that link to the video in the chat, and then I will share my screen for our next presentation from Marissa. If it will let me. There we go. Wonderful. Marissa, come on. Come on over. There we go. I can see you. I'll spotlight you. Go for it.
Right.
Thank you.
So I will talk a bit about the work package on drinking water supply and specifically on the water quality of the drinking water supply. So on the picture, you can see, for example, an inline chlorinator, and I will get back to this a bit more in detail, but this is just an example of what we have installed in one of the 2 towns. And first I want to give you a bit more of a background. So next slide. So we first did an assessment of the water quality in both towns, in Kakooge and Wobulenzi, where we are working. And we looked at the water quality at the tap level, so in different water sources. So we looked at piped water, but also boreholes. So hand pumps are very commonly used, but also other sources like rainwater or open water sources. And what we saw is that piped water systems are more safe than other sources like rainwater or open waters, but still around half of the samples that we tested, they tested positive for E. coli. So E. coli is a good indicator of fecal contamination in water sources. So as you can see, more than half of the samples were contaminated, and some of them were having a high risk. And then also looking at the household levels, so when water is actually getting consumed, so the water that people would be drinking, that's in the picture here designated as storage. So that comes like after people have stored their water after the collection. The quality also deteriorates, so you have much higher risks. And what we also saw is that within the piped water supply, at the tap level, we didn't find a lot of taps that had still chlorine residuals, although there was a manual chlorination that has been done. So that's why we also see this recontamination. Next slide. So here you can see the manual chlorination that has been going on. So you can see the operator mixes the chlorine solution, and then it is poured drop by drop. It's going into a reservoir tank. And this actually, what we saw is it leads to inconsistent chlorine dosing because the water that is incoming is not always with the same flow rate. So either you underdose, as I said before, that brings microbiological risks, or you can also overdose. And this has big implications on the acceptance of the water. So if you overdose, you have more, you taste the chlorine, you smell the chlorine in the water, and this leads to reduced user acceptance. So yeah, we want to see how can a consistent chlorine dosing be achieved. So as said before, we did this co-creation workshop. We went on as well to do a road mapping workshop where we looked at what priorities are there. We had town council members, political leaders, the water utilities as well in the towns that joined. And one of the priorities was having safe water, and also like in the piped supplies, the chlorine dosing. So we then went into selecting appropriate chlorination technologies. We went for inline chlorination options. So this was also like based on existing supply chains, what training needs would be required, what would be the cost. So we started this process together with the water utilities at a very early stage. Next slide. So for Kakooge, which is one of the towns, we then partnered with Water Mission. So with the Central Umbrella of Water and Sanitation, which is the local water utility in Kakooge, we have installed inline chlorinator in their piped water supply system. It's an erosion chlorinator, meaning it's tablet-based. So if you can see on the picture below on the left, in the middle, there are these boxes that you can open and put in tablets. Exactly, so that when the water passes through, the tablets get slowly dissolved so that you chlorinate your water in a consistent way. We also trained the operator there, and he now also does the operation, but also the chlorine monitoring so that he can then adjust the doses based on what he sees directly. And then in Wobulenzi, similarly, we looked at a different technology, also an inline chlorinator. However, we partnered with Clara, which is an electrochlorinator. So this means that we only use normal table salt that we mix with the water and do an electrolysis. So this is powered by a solar power source. And with this electrolysis, we are able to create a chlorine solution. So this actually eliminates the entire supply chain of having to have chlorine powder or tablets. So generate your chlorine solution on site. And this chlorine solution is then automatically injected in the pipelines. And we do have a remote monitoring as well to check on the flow so that the correct dosing is applied. So next slide, you will see here that we did the installation. So in Wobulenzi, there's the National Water and Sewerage Corporation, which is present. So they're the main water supplier. So we partnered with them, did the entire installation together. We also partnered with Get Water Uganda, which is an NGO, which would then act as a local partner for any bigger, larger maintenance works if needed. And yeah, so we proceeded to do an operator training, worked very closely with the staff of National Water to train them in how to operate, how to do the chlorine solution. And you can see how it looks like. And on the next slide, you'll also see the entire setup. So you have the solar panel that provides electricity. We had to do a structure around the machine just to prevent any theft. And on the right, you can also see we integrated the water quality monitoring into National Water's routine water quality monitoring. So they now take samples at strategic points before and after the installation of the machine to track the water quality, especially the free residual chlorine. Next. To summarize, the key lessons were that inline chlorinations have the potential to provide more consistent dosing than manual chlorination. And they also reduce the operator workload because they don't have to mix their own solution every day. So there's less time needed for the operator. However, to have like a long-term success and really sustain the operations, close collaboration is needed with the different stakeholders, specifically the utilities that are already present there. And it's not only once the technology is installed, but from the beginning, from technology selection to installation, training, and then later also in the monitoring phase. And what we see is also that regular water quality monitoring and especially the follow-up during the first months are critical to really establish this routine of operation monitoring, having a response system based on what the operator is seeing during the monitoring. So these first months to establish this routine is needed. Follow-ups are needed to establish this sustainability. And yeah, finally, if you want to learn more about different chlorination approaches and technologies, it's a short brief that we did for practical implementation of those technologies. It's from a context in Nepal. However, it's valid also for global application. So it outlines a little bit on the different technologies that can be used for small water supply systems.
Wonderful. Thank you so very much. We will continue to accept questions in the chat, and Marissa will be happy to answer them when we get to our question time in just one more presentation's time. So I'd like to invite Dr. Ronald to come on screen as well and present a little bit, pulling all of these different pieces together into planning. There we go. Wonderful. Over to you.
Well, thank you so much, colleagues and the previous speakers for the wonderful background that enables me now to step in, talking about integration. And specifically, we are trying to look into what are the best ways to increase performance of water supply, sanitation, and solid waste. And this led us to thinking of coming up with an integrated planning framework for water supply, sanitation, and solid waste. I'm glad that many of us have already shared the leading information and studies that actually brings us to this level. So next. Yeah. So what is then this integrated planning framework, and what should be the idea behind us coming up with this, and what informed us to think in this direction? One, we appreciate that water supply, sanitation, and solid waste, as has been discussed already, are interlinked service sectors. And unfortunately, there's a number of these findings from the previous works that has indicated that these interlinkages are currently promoting negative impacts. Refined solid waste in the stormwater that leads to surface water. We find this the sanitation facilities leaking or leaching into underground water and so on. So, but then if we not address such gaps, then we could have a problem, and therefore that's why we thought of a service innovation as an integrated planning framework. And this planning framework looks into one, enabling environment. Here we are asking ourselves, who are the sectors, who are the actors, and how can we collaborate? Looking into water supply, who are the actors, sanitation, who are the actors, solid waste, who are the actors, and can we be able to collaborate? And if possible, how? So this kind of questioning helps to identify and therefore build a coalition stakeholder map that is able to begin the planning activity. And once this coalition stakeholder map has been established, then we are able to enter in the field and be able to carry out what we call integrated baseline assessment. So this, in our study during WABES project, we're able to appreciate and chronologically test each of these steps. So the integrated baseline assessment was done, and the overarching question behind that was that for us to establish where we are and what do we need to, where do we need to go. So as the stakeholders, as we come together, or as we try to appreciate the integrated planning framework, we need to ensure that we work together, but then carry out an effective integrated baseline assessment by asking ourselves or establishing the evidence and asking where we need to go. So this, in our study, was able to give us the evidence base and channeled out the shared vision, and therefore we also came up with the system mapping. So with the system mapping, the evidence base, and the shared vision, then as a coordinated, collaborative stakeholder team, we were able to proceed through road mapping and solution engineering. Here we are basically looking at how will we get to where we want to go. And in this, you already have the evidence, you know what is happening, you know that there's water pollution, you know that the pits are not emptied, they are not lined, and therefore they're the ones that are possibly leaking into the groundwater. That's why we find fecal coliforms in underground water and so on. We also know that, okay, the solid waste is not being collected on time. So all this has been established during integrated baseline assessment. So then here we, as again, an established governance coalition team or planning coordination committee, you prioritize, and then again as a team, utilizing the synergy and the experience from each team, you prioritize these kind of challenges and then identify solutions to each challenge and profile them. So with that, you're able to either prepare an action plan, which action plan then leads us to the next step, where now that action plan should be modularly coordinated or should be broken down into basic, affordable, and clear project modules. So at modular and coordinated planning, as the fourth stage, we are asking ourselves, where we have these problems, we have high level water pollution, we have, unmanaged solid waste, for example, that's causing flooding, as members have already presented. We have maybe gaps in the capacity of a team that are supposed to handle some of these activities. So we modularize that. And with the modularization, we are asking ourselves, what do we need to do first and when? So you attach the timelines to each module. And this, in a way, helps you to create a bankable project portfolio that in the event that you are actually seeking for financial support, then you are able to understand that when these finances come, I'll be able to handle this because it's the most critical, and I will follow up with this, and so on and so forth. So if these 4 stages are implemented, it goes without saying that we then need to monitor the project implementation. We need to monitor the implementation. We need to appreciate what we have done. How effective has it been? What have we learned from this? And if there are gaps that we could have, created, or the thing that we could have missed during the first 4 stages, then we're able to go back and improve at each stage. So, and if what we have done works well and is befitting, then we are able to, adapt and scale it up. So this again, integrated planning framework is a framework that has been systematically developed with the inclusion of all the stakeholders available. It has been validated and it's under testing. So it's important that we move alongside the technology that have come up, that have been developed and everything else. We need also appreciate the service innovation. And this is one of the service innovation approaches that we could attach to the available innovative, technological innovations that are already in place for us to improve on service delivery, especially in these developing small towns. I want to leave it at that's what I encourage more questions, and could have targeted responses to some of the questions. I want to thank you so much. Okay, this slide, this is basically, as we have mentioned, that the modular plans are then implemented, and how we come up with the ranking. It helps, to be able to appreciate some of these things. And we, in these small towns, we have already successfully, from the ranking of challenges and solutions, we have already successfully installed the WRI system. We have carried out sensitization, which has been successful. We have handled channel toilets in this in response to unlined pits, and the challenge of contaminating the underground water. We have also planned a landfill. A dump site, which also solves the problem of unmanaged landfill. Dump site dumpings, which in the end they end up being moved to surface water and leaching to underground water. These are some of the things that we have tested already, and they show that they're working, and have been tested using the planning framework that is already shown previously. So we think that this is quite some innovation that we actually could try to work with and see what happens. Thank you so much. Over to you, Jessie.
Thank you so much, Ronald. Thank you. I'm going to also type into the chat the link to the Integrated Planning Framework learning guide if you're interested. It's just 2 pages, and we'll be sharing more about this in the coming months. So please watch this space. I'm going to invite Marissa and Matteo also to come on camera. I hope you have found a couple of good questions in the chat. And let me ask you to start your video, Matteo. Yeah. And if you have questions, please continue to plug them into the chat, and we will do our best to answer them. So we'll start at the top with Matteo. I've got to scroll a little bit because we've had so many wonderful questions. Looking around, the first kind of question is around who's conducting the monitoring. So who are we working with, Matteo, for this type of work? Oh, I've just asked you to unmute.
Yeah,
Yeah,
I couldn't find the
all
button.
good.
Thank you very much.
Yeah.
Yeah, that's a very good question. So I am just a part of the wider project. So the monitoring and particularly the pathogens monitoring was done beforehand with partners on site in Kampala. It was done by Seiju Kang, which is a postdoc here at Eawag, and it was yeah done in collaboration with the Makerere University as well.
Great, thank you. Yeah, wonderful. I'm scrolling. We've got lots of good comments. Florence says, according to the look of things, I believe sewerage in Kampala requires long-term engineering and massive capital investment. And Matteo, don't feel like you have to answer this if it's outside of your realm. How do you think we can transition WASH from short-term localized pilots into scalable municipal infrastructure? And Ronald, you're also welcome to jump in. Yeah.
Yeah,
Matteo.
Ronald, do you want to go first? I was trying to type an answer on the chat directly, but if you have any idea, you can go. Otherwise, I have a few suggestions maybe.
Like maybe oh yeah, Ronald's back.
Oh, okay. Yes. A question. I was still running through the number of
There's a lot.
questions.
Yeah.
Which one is that?
So it's kind of for both you and Matteo together. So thinking specifically about Kampala, so outside the small towns, but sewage in Kampala requires long-term engineering and capital investment. How can we transition from short projects, localized pilots, to scalable, citywide, and town-wide, thinking more than just a few small towns? How do we scale?
Thank you so much. And it's quite a very interesting question. One, I want to actually pin it to the framework that I've already, discussed. One way is to ensure that we appreciate the effort, the capacity, the experience of each of the players or the actors in the field that you are actually working in. So with that, then you're able to seemingly work together and bring the budget together, bring the challenges together, coordinate, rank, and be able to move. In that way, there will be synergy between the different projects. And if that synergy is maximized, then you're able to scale it up. The challenge that has been there on my water supply, then I will find that it's interfering with the sanitation programs in a certain sector, and then I will have my projects broken down and restated and so on and so forth. So I think, one, coordinate both technically but also financially. With the little resources that you have, you're able to utilize it in the most efficient way and scale up. Thank you.
Thank you very much. There's a question really specifically on Matteo. For Matteo, we'll go Matteo, and then we'll go to Marissa, and then we'll come back to Ronald. What percentage, to what percentage, an estimate, if you know, has building use or area activity influenced sanitation technology selection? That seems to be a question less for maybe for you.
Sadly, I don't know exactly the percentage of that influences technology selection, but what I can share with you is maybe the preliminary analysis that I've conducted. And we see a positive variation between fecal loads and the activities areas. This could be due to a lot of different things, due to people moving around, containment technology as well, of course, but also how emptying is performed in non-sewage facilities. So I don't think, sadly, I have the data to be sure yet that it is because of one particular area. But I think what influences these loads most is basically how sanitation is managed, and it could be a great, I don't know, shopping center, and then you could still have badly managed or poorly managed sanitation there. So what we think so far is that the movement of people within a given catchment will have an influence, and across catchments as well. So it's more of how people behave and not only on technology alone.
Yeah, amazing. Thank you. I'm going to move to Marissa. Thinking about the initial investment costs, the nuts and bolts of how much do these things cost? Maybe you can share a little bit about how we financed and and supported the financing. Go for it.
Yes, I think this is a very important question to also scale up things. So there are a lot of trade-offs as well in installation costs and then also long-term operation costs just in general. And we can also see that typically in those two technologies we installed. So for the inline chlorinator that uses tablets, I could just give you a rough estimation of, let's say, around $2,000 that the installation costed. And then compared to the other one, the blue box, the Clara electrochlorinator, that was a higher cost. So this can cost up to 10,000, for example. It depends also like on the capacity of the machine. But now looking at a broader time frame and not thinking of only installation cost, the Clara electrochlorinator uses only table salt and solar power. So in the end, like the long term, like the operational costs will be much lower than if you always have to use tablets, get chlorine supply, buy the chlorine tablets. So this is a bit of a trade-off, and we can see that throughout the entire chlorination sector. So it's quite important to have this in mind and plan also not for just a year, but think of the longer term. So I think that's what I would answer to this.
Wonderful. Thank you very much. Yeah. And remember, like maybe just as a fun reminder, we are a research institute, and so we aren't an implementer. This isn't normally what we do, but we wanted to do some pilots as part of our work, and you can see that really came out of the planning process, that came out of the co-creation process, that then led to these pilots, especially in the small towns that Marissa and Laura both presented. Yeah.
Just to add, we did get a third-party funding for this type of implementation. So it was like a follow-up from our research, which was a nice thing. But we, as Jess is saying, we usually don't do those kind of implementation projects alone.
Yeah, we help to provide the evidence and the insights that we hope teams can pick up and take on. There's a really good question around One Health, and there are lots of different definitions of One Health, but what methodology for WASH education? And I'm wondering if that's in WASH education within schools or if that's WASH education towards professionals or targeted for professionals. Aisha, do you want to provide some more detail on what you?
Thank you, Jess, and all the presenters. I wanted to ask basically how if there is use of One Health approaches towards WASH education. I like you mentioned schools. Yes, towards sanitation management and or community total-led WASH. So this kind of One Health synergies, if there is a holistic way you know disseminate these trainings or things like that, or it's purely technical. Yeah. Because I heard you mentioned about epidemiologies, so like disease outbreaks and things like that.
Marissa, do you want to maybe share? Yeah.
I had something quick in mind. So for the work we have done in the two small towns, Kakooge and Wobulenzi, since we worked across those sectors to disseminate and to also move things like make people understand the importance of chlorination, but also like waste segregation. We did what we called an integrated sensitization campaign. And this was really to get our learnings out to the whole town, to specific people, but also just to the community. So we did work with the town council, but also the village health team workers to have a package where we can really disseminate those. And it was not specifically only on chlorination or only on water, but it had like these interlinkages as well between water sanitation and solid waste. But this is just one aspect. Maybe someone else want to add something more.
Yeah, I've just popped that in the chat, and I've also, we did an assessment at schools as well, which is kind of related, and I'll pop the link to that as well. That was from 2024, but an assessment which might also be interesting for school WASH, but kind of in an integrated fashion. We can also point to other collaborators within the Swiss network, the Swiss Water and Sanitation Consortium, who have been working for many, many years on the Blue Schools curriculum. And that includes a variety of different water, sanitation, solid waste, and health training. And I'll pop a link to that as well. That might be a useful toolkit for you. It's currently under revision, and it's in its, I think it'll hopefully will be finished, the latest edition will be finished soon, but that curriculum has been widely used across the globe. In some places it's called Blue Schools, in some places it's called Green Schools, just depending on the context, and that might also be useful. We also have a question around how we do, monitoring, working with champions, hired officers, or existing structures. Does someone want to share a little bit about how we do this kind of research? Maybe Marissa, you want to jump on that again? Yeah. Oops, sorry.
Yes, sir. I don't see the question. Could you repeat? So it's about monitoring.
Yeah, how do we conduct monitoring? And I think this can be the water quality monitoring. It can be also the monitoring on the environmental monitoring. Do we work with champions, hired officers, or existing structures?
Yeah, so one thing I would say is that we, of course, we come in as researchers, but we always try to work together with what is already established in a certain structure. So I can speak mostly for the water quality monitoring. So, for example, National Water has already a water quality officer who does every 2 weeks water quality testing. So we try to embed it then also in those structures. So I think one key point is to use existing structures, use what is already in place to then also train if we want to have like additional monitoring to train people, but also collaborate through key personnel that is already in the towns, for example.
Yeah, thank you. That's great. I'm also just adding in the chat a link as well. We have, we didn't mention it on this call, but we actually have, as Eawag, along with EPFL, which is a university also in Switzerland, we have 4 fantastic online courses that are free. Many of you have maybe done them or are familiar with them. They are MOOCs, or massive online open courses, and we have them for solid waste, for fecal sludge management, and for water. And so I'm going to post the link for those courses in the chat as well, and we'd be very open for you to take those and to learn many of the things we've talked about today. The kind of fundamental and the foundations are included in those MOOCs. Doing too many things at once, typing, and wonderful. Great. I think we have come kind of to the questions are tapering off. So thank you very, very much. If you continue to have questions, and team, if you want to continue to type into the chat, please feel free. We'd now like to have a bit of a self-reflection time. So I know we've had a few people drop off, but we still have over 50 people on the call, which is fantastic. And I'd love for us to go back to that original framework that I presented at the very beginning of today, and that is the adopt, adapt, and abandon. So I'd love for you to think about your work, and we'll start with the word adopt. Is there anything from today's presentation, from the resources, from the tools, anything you would like to adopt into your own work? And I'll give just a moment here, and we invite you to type that into the chat. We'll give everyone just a couple of minutes. Can be also our team. Anyone, feel free. Yeah. Anything you want to adapt, or sorry, adopt. I get them mixed up. Adopt. We'll give everyone just a moment. Yeah, thanks, Christoph. Appreciate it. Wider sharing, making sure stakeholder participation. Fantastic. Yeah, integrated planning, electrochlorination, fabulous. Really, really great. All right, move to the next one. Maybe there's something that you want to adapt. So something in here sparked something that you might want to take and change or remorph, but you want to transform. Composting, low cost innovation. Anything we want to adapt? I have some things I'd like to adapt in my slides. As we've gone through them once, there's some things I'd like to change. Yeah, training for town council technocrats. Great, that's good. Creating benefits for households and waste segregation. All right, and the last one, we've got just a minute left here on this, is abandoned. This is a harder one. You do not feel like you need to type, but is there anything that you would like to stop doing because of something you've learned from today? It gives it a good reflection. Silos, stop silos. Yeah, exactly. How do you... Or abandoning silos. We'll give it just a second. The waste burning, thanks, Abu. Yeah, absolutely. We're going to abandon waste burning. I think I want to also adopt some composting. I need to find out where the composting area is in my local community. I know it exists, but I haven't found it yet. Great. Well, I'm going to invite Christoph, thank you for coming on. I'm going to spotlight you and add you as a pin, and I'm going to invite you to give the closing remarks for today's session. Thank you so very much for everyone who has joined. It's wonderful to have so many wonderful people online today. Over to you, Christoph.
Thanks, Jess. So my name is Christoph Lüthi. I'm the principal investigator of the WABES program. So I'm the one responsible to make sure that the money keeps flowing from our main donor for this program. As you've seen, WABES is an ambitious 4.5-year program of applied research, and unfortunately comes to an end at the end of this year in December. WABES has aimed to improve equitable access to wash and solid waste management with a strong focus on the needs of small towns. I think that has become clear through the presentation that you've heard earlier. I'd like to highlight two main innovations of the program. And the first one is definitely the validation of integrated service delivery approaches for the small towns that we've been working in. And as we've heard from the different speakers earlier, the co-design and co-production allowed us to really target these interventions to the towns that we've been working in. And secondly, I think the existence of a knowledge broker position throughout the 4.5 years allowed us to maximize the translation and dissemination of our key findings and speak to targeted stakeholders around the world. As this is one of the Swiss Development Agency's larger waste sector fundings, we've had an independent evaluation by the policy practice, that's a UK-based consultancy, that has just been finalized over the last 3 months. And I'd like to highlight 3 initial findings. Firstly, and I think that's the most important one, trusted partnerships such as the one that we have with Makerere University and the Ugandan Ministry of Water and Environment allow for a smooth implementation and early impacts. This is one of the strong foundations of the WABES program. Secondly, the evaluators have found that the WABES program was able to engage significantly with both national and local governments on issues and real problems that matter to them and were therefore impactful. And thirdly, they found that the research model that's been used, including co-design, has involved good partnership practices and take-up, and the dissemination work was also taken seriously throughout these 4.5 years. I'd like to close by expressing my gratitude for the wonderful collaboration that we've had with all our partners, the Ministry, the Water Research Institute, the 2 towns we've been working in, and hope that the lessons learned and innovations validated in the towns will spread across Uganda and beyond. Thank you so much, and over back to you, Jess.
Thank you very much, Christoph. It's wonderful to hear those reflections. And yes, we're waiting for the final report from the evaluators, but we're really, really inspired by some of the findings that they've had so far. Wonderful. So we'll be wrapping up, as Christoph mentioned, this program in the coming months, and looking forward to continuing to share insights and ideas with you. We also will have a closing workshop for individuals connected with this program later in the year. We look forward to seeing some of you there. And I will share just very briefly that link to some of the outputs and the learnings from WABES in my screen, and we will close today's webinar. Francis or Gwendolyn, is there anything else that we need to mention for today? The recording and the slides, a PDF of the slides will be shared.
Yes, please. Yes, please. Thank you, Jessie. They will be shared. The recording, the presentation will be shared. Francis will be sharing them with all the people that participated in today's webinar. And we want to thank you for the opportunity to share the information and everything that research you have done in Uganda. And we look forward for more webinars on this research. And we also invite the people who are present and those who are not present, please take advantage of this platform and share your studies, your research that align to water, environment, and climate change. And we'll be grateful to take in. So the next webinar is going to be next month, the last Friday of the month. We always hold them at the last Friday of the month, and everybody is invited to share with us, to share with their communities about their research, their studies on even practical aspects that are being done in relation to water, environment, and climate change. Thank you, Chris. Thank you, Jess. Just otherwise wish you a wonderful weekend.
Happy weekend, everyone.
Bye-bye. Enjoy. Bye-bye. Thanks.
For the presentation team, if you would like to stay online a little bit later, we can have a quick debrief, but also fine if everyone is too warm and would like to take a leave. For those in Uganda, we are having a heat wave here in Switzerland, and we're having crazy hot temperatures, so we're all very warm. Thank you, everyone, for coming.
Thank you for the good moderation.
My pleasure. All good. The hot temperatures come. We should be used to it, but we're just not. Yeah. Thank you, everyone. So wanting just to thank all of the facilitator or all of the team for your amazing work and preparing today. Thank you very much. If you would like to send me any kind of reflections by email, that's also totally fine, team. Just would love to have any ideas on things that we can improve for next time for webinars for ourselves. And I think we can just wrap up. unless anyone has anything they would love to share. We're still waiting for a few folks to drop off, but you can come off of mute if you'd like. I think we can just drop off, team. That's totally fine.
Okay. Thanks,
Yeah.
Jess. See you
Thank
later.
you. Thank you very much. Have a good rest of your day. Stay cool,
Bye-bye.
everyone in Europe. Take care, everyone.
Bye-bye.
Bye.
Bye.
Thank you, Jess.
Take care.
Thank you.
Bye-bye, everyone.
Bye-bye. Thank you so much, Francis.
You're welcome. Thank you too.
Yeah. And I'll share slides as a PDF very shortly.
Okay, that would be great. Thank you.
Okay, perfect. Yeah, sounds good. Thank you.